When kids with autism or toddlers showing signs, or even toddlers with speech delays, go to speech therapy or have early intervention professionals coming into the home, many times prepositions will be worked on way too early. Today we're going to cover when and how to teach prepositions to children with autism and or speech delays. When my son Lucas was 2, he actually did not look very autistic. He was definitely speech delayed, and my husband first mentioned the possibility of autism when he was 21 months of age. But when he was 2, he entered typical toddler preschool without any support, and then a few months later started private speech therapy. Lucas has what I call now, back then he had pop-out words. He'd have words here and there, but at the time, many years ago, I had no idea how to teach him to talk or to imitate or to do all the things that I now am 100% sure on how to teach young children with any kind of delays, how to work on skills. But I talk about his time in speech therapy in Chapter 7 of my Turn Autism Around book. He had an amazing speech and language pathologist, and she was working on a mixture of skills, and many of the skills, like prepositions, were obviously too hard for him back then. So from my vantage point, and of course, especially looking back, only the first part of his weekly speech therapy sessions at the hospital were really great. In these, maybe the first 10 minutes of the 30-minute session, the SLP would work on interactive materials like bubbles and toys with parts and cause and effect toys. And they were really appropriate. And in these activities, the SLP was working on manding or Lucas requesting. She was holding back. She was holding the bubbles to her face. She was saying open and blow and bubbles and pop. And because he had pop-out words, Lucas would tend to talk more. He would look at her. He would smile. And she would say things in a slow and animated way. And that all kind of went a little south when she started working on more advanced language skills like prepositions. She would give Lucas direction, for example, to stand behind the chair, which he had no idea what that meant. She also, I remember her using a dollhouse with toys in the dollhouse, and then gave directions such as put the doll next to the sofa or put the doll on the bed. Lucas needed constant prompting, and then when he wasn't prompted, he would make constant errors on just about every direction involving abstract language like that. I was either in the room or behind a two-way glass if I had Spencer with me. So I didn't know any of this back then, but in hindsight, for sure, after working with thousands of kids, in addition to Lucas, I can tell you right now, Lucas was missing many of the prerequisite skills, such as manding for items that he wanted, and labeling or tacting common items. Labeling, she would say, put the daddy doll on the chair, and it's like, he couldn't even, when you held up a picture of his own dad, he couldn't even label daddy. If daddy walked in the room, he couldn't label daddy. He couldn't man for daddy to come tickle him. So using materials such as the doll who was the daddy was obviously very hard. So is your child or clients ready to learn prepositions? I'm going to cover 3 mistakes people make, parents and professionals, but mostly professionals, because in most cases with typically developing kids, they will develop things like preposition without direct instruction, maybe a little bit in preschool or on TV, but it is a higher level abstract language skills in terms of the VB map, for instance. So the first mistake is starting to try to teach prepositions too early. And this is the most common thing I've seen over my past 25 years in the autism world is, as I said about the VB map, this is a higher level skill. So the VB map stands for the Verbal Behavior Milestones Assessment and Placement Program. It was written and published in 2008 by Dr. Mark Sundberg. I've had Dr. Mark Sundberg on the show in the past. It's been many years, but we can link that in the show notes as well. So on the VB map, we have level 1 skills, which are typically developing skills from 0 to 18 months of age. And then we have level 2, which is 18 months to 30 months. And then finally, level 3, which is the final level of the VB map, which is 30 to 48 months of age. So both receptively following directions with prepositions, like stand behind the chair, and tacting or labeling where's the bear on the chair, are both level 3 skills. They're both for typically developing language skills of a 30 to 48 month old. So even if your child is 3 or 4 or 8 or 12, that doesn't mean they're ready to learn prepositions. The only way to know that they're ready to learn prepositions are to look at the prerequisite skills such as manding, requesting. I'd say at least 100 items. Labeling, again, 100 items, 50, 100 items. Talking. Now, can you do this with a device? Yes. Does that take a whole lot more skill in terms of the professional teaching the skill? Yes. So I would say talking in, 5, 6 syllable length words, because if you're going to get a child to label bear, where's the bear on the chair or over the book, that's 3 to 4 syllable length. So they can't just talk in 1 to 2 syllable words. If you're going to add prepositions, they're going to need a little bit more language than 2 syllables. So we can't start teaching prepositions too early. Otherwise, it'll just frustrate the child, and it might really lead to confusion too. He or she is not ready for a skill of this magnitude before they have a lot of these prerequisites in place. Now, there is an article from Games for ESL, and that article suggests teaching prepositions to explain what a preposition is and give examples. This might be appropriate for typically developing kids, but I have a feeling that if any child, even a language delayed child or a typically developing child, to learn prepositions, they don't really need this whole dissertation about what a preposition is and providing lots of examples. As certainly it would not work for a language delayed child or a child with autism who's severely delayed to be hearing instructions of this type. So we do need to use, take into consideration the child's prerequisite skills. And if they are learning prepositions naturally, don't mess with it. Let them pick it up as naturally as possible. Mistake number 2 is not working on prepositions in a systematic way. I developed a protocol and a treatment integrity form and all this complex how to work on prepositions, which is in my online course and community, and it's really way beyond the scope of talking to you about it. But I think in general, just we need to have a systematic approach. My protocol and what I'm going to tell you now to just work on the basics was developed based on a few things. Well, my 25 years in the autism world, I did a consultation with Holly Kibbe, who's a behavior analyst who I'm back in touch with. And she did a one-day consultation way back when Lucas was in early elementary school. And we talked about prepositions there. And then shortly after, around the same time, I worked with an ABA intern who was looking for a research project. So we did a research project on prepositions. And that's how I came up with my protocol. But the major thing with a protocol is to pick one set or two sets of prepositions to work on. The set that I would work on first in almost all cases is in and on. You want to pick prepositions that don't involve movement, like out and off, because that's going to be hard for a child to label. So in and on are two of the prepositions I would work on, and then over and under are also a good set of prepositions to work on, but we have to do it in a very systematic way with lots of trials, lots of success. We can't be working on prepositions. Like if you told me, oh, we've been working on prepositions with this kid for, 3 months or 2 years and he hasn't gotten it. That's not the child's fault. That is lack of a systematic procedure. We need to learn as professionals really how to help these kids as efficiently as possible. Okay, and then mistake number 3 is expecting children to generalize these preposition skills without direct instruction, without data, without materials. It's just not fair to the student to expect them to just pick this up really naturally. If they're not able to pick it up naturally, we need a systematic way to teach them and then a systematic way to generalize as well. So in summary, teaching prepositions is actually a pretty hard skill to teach. It requires learners to have several prerequisite skills, and it involves systematically coming up with a procedure that is effective for the child. And we should not expect generalization until we come up with the best way to teach kids prepositions. So to learn more about whether you're a parent or professional, how to teach kids with autism or toddlers showing signs, check out the information, attend a free workshop. I have so many free resources, but really to get into our courses, community, membership is the way to go to really help these kids as quickly as possible to make the most gains. So I hope you enjoyed this 3 mistakes on teaching prepositions. And if you did, I'd love a comment, a review. Email us, let us know. And I'll see you right here next time, same place next week.